It will be no surprise to you that diabetes is serious business. It strikes people of all ages, but it's especially prevalent in the African American community. You may know that there are two types of diabetes, type 1 and type 2. Type 1 often strikes early in one's life and leads immediately to insulin dependence. A program of exercise, weight control, and proper nutrition can often curb the effects of type 2 diabetes, which accounts for about 90% of the cases.
It's a very common disease. It's not diagnosed enough, and it's not treated aggressively enough. Individuals who get type 2 diabetes are usually sedentary in their lifestyle, they don't exercise very much, and they're usually overweight. We used to say that was a disease of adults, but the reality is that's no longer true. Children are getting type 2 diabetes because our children are sedentary and overweight. The number one killer in terms of complications of diabetes is heart disease. Typically, someone who is diagnosed with type 2 diabetes already has hypertension or high blood pressure. They already have some risk of cardiovascular disease. They may have elevated cholesterol levels, and then you add diabetes to it, and you just multiply that, and so your greatest risk is cardiovascular disease.
The actual test for diabetes is a simple blood test that measures the amount of sugar in the blood. The test is usually done after an 8 to 10 hour fast. Once diagnosed, patients must take personal responsibility for their levels of sugar and their overall health. Regular visits to a doctor or clinic help patients like Wanda Green to keep a close eye on the progress they're making.
I am the only one that has type 1 diabetes. I have uncles, and my father has recently been diagnosed with type 2 diabetes. Having diabetes affects my lifestyle in the fact that I do have to watch everything that I eat. I exercise. That's a big plus in helping to control my diabetes. And I drink lots of fluids, lots of water that helps to keep my sugars under control. My diet itself and what I eat is not a lot of starches. I'm not a big meat eater, so I don't eat a lot of meat. Vegetables, fresh vegetables and fresh fruits are good, which helps out a lot.
Ms. Green has had diabetes for 37 years since she was a child, and although it is more severe than some people experience with type 2 diabetes, the lifestyle changes and control are very similar. She regularly checks her blood and regulates her prescription drugs and her diet based on her sugar level. Nurse practitioner Davita Kruger emphasizes the importance of sticking to a healthy routine.
People who have a family history of diabetes and are overweight are prone to type 2 diabetes. That's one of the major indications. So as if you look at society now and you look at how overweight people are, we're getting more and more diabetes because of that. So nutrition and physical activity truly decrease the risk of complications to diabetes as well as prevent diabetes.